Our app Dermascan, it was originally purposed just to provide AI-powered diagnosis for individuals with unrecognised skin conditions, so an individual who just has something on their skin and doesn't know what it is. As we developed the app, we realised that this sort of thing could have a few extra uses, and we added in a way for individuals with long-term skin conditions such as eczema, as well as GPs, to monitor, upload and track skin conditions. Training the original machine learning model would be done using the DermNet dataset. User data could then be used in future months to increase the size and effectiveness of this model. And the focus on this weekend was to provide an overview of the product, as training a model would just take too much time, and we don't have enough compute power to do this. So we're going to demonstrate 3 user experiences to explain the app's functions. Cleveland, Consuela and Hartman. Cleveland is a late 20s black man who has an unrecognised mark on his skin. Consuela is an early 40s Hispanic woman who has had eczema since adolescence. And Hartman is a GP who regularly encounters skin conditions he's unsure about. Cleveland will demonstrate a user seeking a one-time assessment of a skin concern, possibly due to social stigma or past experiences with underdiagnosis, particularly for conditions that are less researched across diverse skin tones. Consuela will be a long-time user who's had eczema since adolescence, using the app to track their daily to track their skin condition, which makes dermatology appointments easier, as well as tracking the effectiveness of different treatments. Hartman is a GP practicing in Cardiff who often encounters skin conditions they cannot confidently diagnose, and uses the app to record these encounters, submitting them with their diagnosis or a request for advice. This information would then be anonymised and published online for other medical professionals to use for their research and training. I'll now demonstrate Cleveland's process of using the app. He's just installed it after noticing a discoloured patch on his arm. After installation, he's presented with a request to upload a clear area of his skin. This allows the program to compare his condition to more similar skin tones, as there may be difficulty detecting it if you've got dark skin or light skin. So using a data set that is more fine-tuned to your colour will be easier. There will be an information button that will give direction on how to take a clear image for accuracy, and details such as lighting and distance for the most accurate recording. After uploading, it would request additional details, such as if the area is dry, itchy, or has been... and also you can upload your own notes. After a brief analysis period, the app would then display a predicted diagnosis with an accuracy meter, as well as some useful links and points about the condition. In this case, it is likely skin cancer, so it recommends seeing a GP. Unlike Cleveland, Consuela is a regular user of the app, tracking her eczema daily. She's just started a new medication and wants to be able to record its effectiveness for her meeting next week. After inputting her medication details, it will highlight the period on her calendar to show that she will be on medication for that period. Each day is displayed in miniature and could be clicked on to focus on that day. There will be a print button that could be used to export any period with images and details in a PDF format to take to a dermatologist meeting for easier sharing. And there will be a daily notification sent out in the afternoon for users of the app that have not uploaded any images. A GP or other practitioner would use the professional mode, which would operate in quite a similar manner, but would allow them to tag cases with their patients' names, as well as including more data and being able to request advice on any records in the event that it needs to be transferred to a more experienced dermatologist. The support page would have local dermatologists, emergency services and other useful numbers clearly available for users. It would provide links to documents detailing symptoms and prevention methods for the user's conditions, and this would be a suitable location to link to information about how the user's data would be processed and used for training and research purposes.
I just saw a bunch of very similar apps on Play Store that kind of diagnoses your skin condition that is already out there. I just wanted to know, like, whether you have managed to kind of come across these, and how is this app different from the ones that are already there?
We were just trying to produce something over the weekend that could be practical. We hadn't done much research into other similar apps, so
the point we sort of say is it doesn't matter if it's been done before. It's what you've learned as you've been going through doing this. Yeah, we had a conversation. I'll let the other people.
So one of the use cases you mentioned was people talking about conditions that are stigmatised or conditions that are less well researched. How do you think you might be able to overcome some of the challenges that will pose in the lack of data available on those conditions that will correlate with them being less well researched, less prevalent, less common, etc.?
In the beginning, it would be not as effective, but due to the number of people that would be using it and regularly updating daily differences, that would help it very quickly build a large data set that would be much easier to analyse and detail and sort of develop it so that if someone were to use it later down the line, it would be far more effective to recognise them.
Do you have any worries about somebody being told on an app that they got an 80% chance that they've got cancer?
I think that you're probably better safe than sorry in that case, and the worst case scenario is you're going to go in and then a dermatologist or GP will confirm that, or you go in and you find out that it's wrongly diagnosed you, and while that is a bit of a scare, it's better than it incorrectly diagnosing you and saying, well, you might not, so don't worry about it too much.
Thank you very much. We're out of time.